And so at this point, I would like to turn it over to John Morgan, who will introduce himself as the speaker of the day.
For sure Karen was going to introduce me. The speaker today is supposed to be Lisa Christie, who's the Public Affairs Officer for Central Iowa Veterans Administration. Because of the weather, and they had more snow than we did first part of the day in Des Moines, they were experiencing blizzard conditions, and she called and felt that it was going to be risky to travel, and so I told her, then please don't. So thanks to Christy, or Lisa, she was able to provide me some information that I can share with you about the veterans clinics in Iowa. Before I do that, I just wanted to remind you about the other programs that have occurred in January and the theme that was trying to be, I guess, continued throughout the month. The first program was provided by Kurt Walterbach. And Kurt's a physical therapist, and the purpose of his, presentation was fitness, to let all of you know that, your bodies continue to need exercise every day, and that through some warming up exercise, common sense about staying active, you have a great likelihood of staying fit. And that's what he was here to encourage you to do. So I thought to start it off, it might be neat if you could focus on yourself and what you can do for yourself to stay fit and active. Then we had Scott Tornquist. And I thought it was neat to have Scott come tell you about a free clinic that we've developed in our own city. So we have all the news now about health reform and all those that don't receive services right here in our own little Mason City through fund development and through the volunteer work of healthcare providers. We've developed our own free clinic. And so it's really kind of a neat initiative that we have here in Mason City. It's something that we should all be proud of, and I wanted you to know about it. Lastly, I wanted you to know about the VA clinics. Being a former Marine veteran without a cane, I thought it would be good that you would know what's occurring with veteran services in the state of Iowa, not only for folks like me, people that are older, but also for those that are currently serving. And it's really quite a neat thing that they've done. And what that is the VA is in the process of developing convenient services for veterans throughout the entire state of Iowa. So what does that mean precisely? What that means is that in Iowa, we have two large veterans hospitals. One is in Iowa City and the other is in Des Moines. We also have outpatient clinics. And the reason these have been developed is they want services available to our veterans more conveniently, so they don't have to travel to Des Moines or Iowa City. They can get the majority of the care that they need in their own communities. So there are outpatient clinics in Cedar Rapids, Coralville, Bettendorf, Dubuque, Fort Dodge, Knoxville, here in Mason City, Shenandoah, Sioux City, Spirit Lake, Waterloo. Our area of the state is referred to as VA Central Iowa Healthcare System. The state of Iowa is divided into three sections. The eastern section, headquarters in Iowa City, the central headquarters in Des Moines, and the western, and their headquarters is somewhere in Nebraska, I'm assuming Omaha. So what have we developed here in central Iowa? Well, the VA hospital in Des Moines is a 381 care bed hospital. And they provide both acute care and mental health services there. Some of you that recall, there was another clinic that was located in Knoxville. And it primarily was long-term care. Also might be thought of as nursing home type care. Well, that facility was closed, and they've developed a new long-term care facility, which they call Community Living Center, on the Des Moines campus, and it's a 140-bed institution. If you ever went to the old Knoxville Hospital, and I had reason to visit there several times. It's really quite a wonderful thing that it's closed. It was certainly time. So that's another enhancement that's occurred. Then we have the VA clinics in central Iowa. They're located in Knoxville, where the old hospital was on those grounds, and the grounds are quite pretty. Here in Mason City and also in Fort Dodge. In Mason City, our current clinic is being expanded. So it will be expanded so that it's going to be a little over 9,000 square feet. Well, that's quite a good sized clinic. And currently, they provide services to over 4,500 veterans a year. And the expectation is that's going to grow. Also within central Iowa, there are 2 other clinics that are planned, one for Marshalltown, and that's to be completed in March of this year, and another one in Carroll, Iowa. If you don't know where Carroll is, just get on Highway 30 and drive west a while until you get on Highway 71, and there's Carroll. So it's kind of neat then on that Highway 30 link, you've got Marshalltown and Carroll. What specific services are provided to our veterans? Primary care, just like it's a regular outpatient clinic. Mental health. They also provide something they call home-based primary care, which is essentially, home nursing. And then they also have audiology. And the 2 other things that they have are primarily for our current veterans, and they're entitled Operation Enduring Freedom and Operation Iraqi Freedom. And what these are for is veterans that come back after having recently served, that they can avail themselves of health care at these clinics for 5 years after discharge. So that's pretty neat. All right, eligibility. Who can use one of these clinics? Well, the guidance itself is, that I'm going to be able to pass along is relatively general. There are specific forms that have to be filled out for a veteran to have his eligibility assured so that you could use a clinic, use their services. But basically, if you had an in-service disability determined prior to or shortly after discharge, and you've been awarded a disability award, which is in terms of percent, then you would qualify for services at that clinic for that related disability. And then I mentioned the new veterans 5 years after discharge. And then for other veterans, depending upon your income level, you could still qualify for services at one of the veterans clinics. And I don't know exactly, I can't tell you this is the limitation in terms of income, et cetera, because I don't have that data. But I do know that they're fairly generous, and several people that I've talked to use that VA clinic to get their pharmaceuticals. And so that if you qualify, that's really quite a nice benefit. So anyway, I'm quite pleased to tell you about the VA clinic and their current operations and their plans to expand. That is the sum total of the information that I have to pass on to you today. So if you have any questions, I'm probably not prepared to answer them. If you want to know about my military service, or if I can spell the word veteran, I can answer it.
John, where's the local facility located?
I'm sorry, I should have said that. If you're familiar with the location of the old AAA building on the corner of Pierce and 6th Street Southwest, that's where the VA clinic is. They currently dominate the entire north lower level, and they're expanding, and I'm thinking they're going to probably take up most of the first floor. So it's quite a convenient location, and since it is on the first floor there, it's convenient to the veterans. And I did visit that clinic twice just to talk to a couple people, and it is quite busy. So they are providing quite a number of patients' services there. How many veterans do we have in the room? I never want to miss an opportunity to say thank you to a fellow veteran.